I want to start with urinary tract infections because it really does bring a lot of women into the urgent care, and it's usually just a slip up on your part. And you know the rules. It's just sometimes you're like, maybe I could break it just this once. So I believe in what I call pop-up sex. And that means that I push him off and I pop up and I go to the bathroom because I was the one who had honeymoon cystitis, never had a UTI in my life. All of a sudden, I feel horrible. I can't, what's going on? And they're like, you have a urinary tract infection, didn't you know? And I'm like, no. So, pop up after sex. Always pee immediately after sex. People are like, you can lay there for 5 minutes. Really? Really? Because an orgasm makes you close all your sphincters. And then as you relax, they're opening and all the juice and bacteria is flowing everywhere. No. Come on, ladies, let's go, let's go. Get up. Okay, so that's rule number 1. Rule number 2, if you have a really splashy diarrhea and you're like, I don't have time to shower, but I think that might have come up front a little bit, sit there until you have to pee again. Pee on a little piece of toilet paper, well, a big piece because you don't want your hand wet, some toilet paper, okay? Pee on that and then use that to wipe backwards. That can help you not get a UTI from diarrhea. Now, a lot of you come to me in urgent care and you've been taking these and you thought it would solve the urinary tract infection. These can only reduce the pain. They can't get rid of the bacteria. You need to be on antibiotics for that. So that's why we prevent first, and then we could use this to bridge us till we can get there because it reduces the pain. But ultimately, you are going to need an antibiotic if you get a urinary tract infection. I have some rules. So you pee every 4 hours when you're awake. You drink enough water that you have to pee every 4 hours. If you can go 10, 12 hours without peeing, you're not drinking enough water. Pee after sex, and then standing in the shower, pee like a man once a day. And the order is you wash yourself, you rinse yourself, you pee, and then you rinse again. And a lot of you, especially the older generation, are completely sicked out by this, and you're always like, pee in the shower. Trust me, if you have men in your house, they're peeing in your shower. They're doing lots of things in your shower. So feel free to just relieve yourself. Now the difference is when you're standing up, your bladder's gonna empty by gravity. When we sit down, there's a little bit of folding and some can be pocketed in the back. So that's trying to prevent a UTI, treating the symptoms of a UTI, and then getting antibiotics to get rid of the UTI. Next, we're going to go on to yeast. Now, if you're eating a lot of sugar and you start to get vaginal itching, it's a sign that you are feeding the yeast. So when you're making bread, if you take your yeast and you add a little bit of sugar to it, it'll start bubbling. And that's because the sugar is feeding the yeast. And so if you have yeast problems, getting on probiotics, using kefir, kimchi, sauerkraut, yogurt to take orally to keep those levels up. The other thing that is antifungal is oregano and garlic. I know someone who puts garlic up her hoo-hay, so that's not me. I'm not someone who's gonna put yogurt up there. I'm going to take that orally and let it work for me, and then I'll reduce my sugar so that I don't itch. But if you are having some problems, this came from, I believe this is Walmart that I got this, but it wasn't very expensive, and it has homeopathic yeast relief in it. Then you've got your Vagisil cream for itching. You also could use a little bit of an athlete's foot cream externally. Don't go shoving this up inside, but you know, like so that you don't use your fingernails to take yourself to the raw point. Some people put tea tree oil. I find this a little too stingy for my tender mucous membranes. And then hydrocortisone cream can reduce any swelling. So that's an option too. Finally, we're going to talk about sex a little bit. I was so happy to see this at the dollar store because I'm entering the menopausal years and there is some vaginal stuff going on. This is not sticky and it's warming, and it was nice for him and it was nice for me. And so if you're having any sort of issues or you're thinking of going somewhere you normally wouldn't go, I would recommend this highly. I think it is necessary for every woman who isn't with one man only to have condoms. Now this is getting a little bit biblical, but women are internal and we're vessels. A man can get up and he can pee and shower and he most likely will not get an infection. However, when a man doesn't wear a condom and he enters inside of you, he gives you a part of his skin flora and bacteria. And so if this man is not your partner, or you think he's not faithful, insisting on condoms is the only way to not allow this bacteria to get inside of you. We have a lot of girls running around now seeing 3, 4, 6 men a month and not wearing condoms, and they keep coming back and they have this infection and that infection. And it's not just STDs, it's bacterial vaginosis, it's yeast overgrowth, it's all these competing bacteria within their system. And so take care of your health. Don't go by his health, because he'll take care of him. They always do. But you make sure that you're not going to develop pelvic inflammatory disease or abscesses, fibroids, all these bacteria-laden diseases in the future because of your partners. Condoms. Okay, ovulation and pregnancy tests. Now, if you're trying to get pregnant, an ovulation predictor can be helpful because it could tell you if you were ovulating. And it's usually 14 to 15 days after your last period that an egg will release. And so then the pregnancy test, I liked that these are at a dollar store because a lot of people are like, yeah, I did one and it was positive at home, and so I'm just coming here for the confirmation. Well, the test that I have available is almost exactly this test. So if this was positive at home, you can likely consider that a positive, but you could come into urgent care and request a referral to OBGYN or request that a blood level be drawn so you can find out how many weeks pregnant you are. That would be good use of urgent care versus I just need a pregnancy test. They're $1. Okay. All right. Let's see. What else could we talk about? Women's health. Hemorrhoids. Ouch. This comes from the constipation. So, and pregnancy, you know, you've got all that pressure from the baby pushing down. So women can get hemorrhoids and they can be really tender. This cream is available. It is pretty effective. The most effective way to keep hemorrhoids reduced is to really be careful about constipation, because constipation causes shearing and tearing, and then that area can build up a hemorrhoid. We have Anusol suppositories that we can give you in the urgent care. Likely your insurance won't cover it, and it usually costs about $30 for 6 of them. And what they are is they're steroid in a little rectal suppository that you slip up in, and then it shrinks the hemorrhoid. This is the same thing, except for it's not as concentrated. And so trying to treat the hemorrhoids, but then preventing hemorrhoids in the first place, really making sure you keep your diet healthy is going to be very valuable for that.